Shamuvanti. Glucose spikes the silent trigger of modern diseases. Science explained. Most people believe disease begins when blood sugar becomes high on a report. But long before diabetes is diagnosed, something more dangerous happens silently, daily, repeatedly. Glucose spikes. A glucose spike is not a disease. It is a biological insult. Repeated glucose spikes damage blood vessels, nerves, organs, hormones, the brain, and metabolism, even in people with normal fasting sugar and normal HbA1c. In fact, many people develop heart disease, fatty liver, obesity, PCOS, kidney disease, and dementia without ever being labeled diabetic. Why? Because glucose spikes harm the body long before diabetes is diagnosed. Part 1. What is a glucose spike? A glucose spike is a rapid rise in blood sugar after eating, usually within 30 to 90 minutes. Common causes: refined carbohydrates, refined, white rice, bread, biscuits, sugar, sweets, desserts, sweetened beverages, fruit juices, ultra-processed foods, eating carbohydrates alone without protein fat. A spike is not just high sugar. It is speed plus height plus frequency that cause damage. Part 2. Why glucose spikes are more dangerous than fasting sugar. Many people say, "My fasting sugar is normal." But science shows post-meal glucose spikes cause more damage than fasting glucose. Why? Because spikes create oxidative stress, trigger inflammation, damage blood vessels, stress the pancreas, drive insulin resistance. Repeated spikes are like repeated small burns inside the body. Part 3. Glucose spikes and insulin overload. Every glucose spike causes an insulin spike. What happens over time? 1. High glucose, high insulin. 2. Repeated insulin surges. 3. Cells stop responding, insulin resistance. 4th, pancreas produces even more insulin. 5th, fat storage increases. 6th, energy crashes. 7th, hunger increases. Insulin resistance begins with glucose spikes, not with diabetes. Part 4. Glucose. Spikes and chronic inflammation. High glucose activates NF-kappa, B, inflammation master switch. Increases IL-6, TNF-alpha, increases oxidative stress, damages mitochondria. This leads to joint pain, fatigue, poor immunity, accelerated aging, chronic diseases. Glucose spikes are pro-inflammatory events. Part 5. Glucose, spikes and heart disease. Repeated spikes damage blood vessel lining, endothelium. Increase LDL oxidation, increase triglycerides, promote plaque formation, increase clot risk. Many heart attacks occur in people with normal cholesterol, normal fasting sugar, but frequent glucose spikes. Heart disease is often a post-meal sugar disease. Many Yanda Part 6, glucose, spikes, and the brain. The brain is extremely sensitive to glucose fluctuations. Glucose spikes cause brain inflammation, oxidative stress, insulin resistance in the brain. This leads to brain fog, poor concentration, mood swings, anxiety, depression, dementia, often called type 3 diabetes, sharp sugar highs, sharp mental lows. Part 7. Glucose, spikes and gut health. High sugar feeds harmful bacteria, yeast, candida, pathogenic microbes. This leads to gut dysbiosis, leaky gut, endotoxin leakage, systemic inflammation. A damaged gut worsens insulin resistance, a vicious cycle. Part 8. Glucose spikes and fat storage. When insulin is high, fat burning stops, fat storage increases, glucose spikes drive, belly fat, visceral fat, fatty liver, weight gain even with normal calories. It's not calories alone, it's insulin triggered by spikes. Part 9. Glucose, spikes and aging. High glucose causes glycation, ages, collagen damage, skin aging, wrinkles, stiff blood vessels, organ aging. Repeated spikes accelerate biological aging. Part 10. Who is most affected by glucose spikes? Prediabetics, diabetics, PCOS patients, fatty liver patients, obese individuals, elderly, sedentary individuals, people eating frequently, people drinking sugary beverages, people eating refined carbs without protein. Common myths. Only diabetics should worry. Everyone is affected by glucose spikes. Brown rice, honey doesn't spike sugar. All carbs spike sugar. Speed matters. Exercise later will fix it. Damage already occurs during the spike. Part 11. How to reduce glucose spikes. Key principles. Eat protein first. Add healthy fats. Avoid refined carbs. Reduce sugar and juices. Eat fiber-rich foods. Avoid frequent snacking. Walk 10 to 15 minutes after meals. Sleep well. Manage stress. Blunting spikes is more important than cutting calories. Conclusion. Glucose spikes are not harmless ups and downs. They are repeated metabolic injuries. They silently damage blood vessels, heart, brain, liver, kidneys, hormones, gut. And they do so years before disease is diagnosed. Health is not just about keeping fasting sugar normal. It is about keeping glucose stable throughout the day. When glucose becomes stable, insulin calms, inflammation reduces, energy stabilizes, hunger reduces, fat-burning resumes, brain clarity improves, aging slows. Modern disease does not begin with diagnosis. It begins with daily glucose spikes. Control the spikes, and you control the root. Holistic Wellness Foundation. IMFAL, Healing Beyond Boundaries.